We are going over the best beginner knee physical therapy exercises. First and foremost, sorry for the bait and switch. There really are no best exercises for knee pain. The best exercise is probably going to be very specific to that person, how irritable they are, how strong they are, what's their training background, what is the pathology that they're dealing with. These are just some of my favorite exercises that I've used over the course of time that I wanted to share with you. Okay. They're going to be beginner exercises, which basically means you have someone who's very irritable, right? Or they're not very strong or don't have much of a training history. This is a great place to start. Okay. If you want to learn more about the best evidence-based treatments for patellofemoral pain syndrome, which is the most common form of knee pain you'll see as a physical therapist, click this link right here. We'll put a link in the show notes so you guys can see what the evidence says you should do for treatment. Okay. If you don't want to hear me droning on about why I like these exercises so much, go ahead and click on the timestamps and you can just check out the exercises right now. You don't have to listen to me. All right. Otherwise, I'm going to give you some idea of why I like these exercises. Okay. So in terms of pathologies of what these exercises are going to be best for, it's going to be best for disorders of the patellofemoral joint complex. Okay. So what am I talking about here? Disorders like patellofemoral pain syndrome, patellar tendinopathy, Osgood-Schlatter syndrome, quadriceps tendinopathy, patellofemoral cartilage injuries, and patellar instability. Okay. So these exercises are going to be putting less stress on the patellofemoral joint in the beginner stages and more stress on the patellofemoral complex in the later stages. When it comes to the tibiofemoral joint, the pathologies there, it's also applicable, but it's not as directly relatable as it would be to the patellofemoral joint. Okay, so that's a little bit more of a nuanced discussion. To a lesser extent, these pathologies are going to benefit from these exercises. So meniscus pathology, tibiofemoral osteoarthritis, cartilage injuries, ligamentous injuries. So that's going to be ACL, PCL, MCL, and LCL. Just keep in mind that these pathologies are a little bit more nuanced, so it's not as clear cut as it is with the patellofemoral injuries. So the best program for your patient is going to be well-rounded. The exercises I've selected are going to be very specific to stressing the knee, also very specific to stressing the quadricep. Okay. A well-rounded program should also have some hip strengthening, hamstring strengthening, some calf strength work. Okay. And work the entire kinetic chain. All right. The other piece is that you should be thinking about specificity for your patient. All right. So if you have a patient that wants to get back to Olympic weightlifting, you have to prepare them for a rock bottom squat with a heavy load and a high speed. All right. It's also important to think about what your patient is actually going to do. If you write them the best program in the world, but they're not going to do any of your exercises, that's not a great program for them. Okay. So we have to choose exercises the patient will actually follow. Okay. So make sure you're thinking about that when you're creating a program. So here are some key notes about these exercises we're about to go over. So first and foremost, these exercises are very light loads. So you'll notice we use a TRX assist. We use a lot of kickstand assists and a lot of body weight exercises. Okay. On top of that, if we're going to load, it's with light loads. Usually we use a goblet hold with a kettlebell or do contralateral loading. So that just means if I'm doing a lunge and my left leg is forward, I'm going to have the weight in my right side hand. If you only have one weight, it's a little less load to the patellofemoral joint. And the other part is that as we descend into a lunge, I'm going to put some good stress on my glute medius on the stance side, okay, which is nice. Our ranges are generally partial range of motion. So from a split squat perspective, we're not going all the way down. From a squat perspective, it's partial range of motion. And our box step-ups are going to be a low box, okay? When we're looking at our lunges and split squats, it's going to be a longer stride length. And what that means is that I'm going to have less knee flexion on that forward leg or stance leg. And that's going to be a little less stress on the knee. Our speeds are going to be low. So thinking about a 2 or 3 second concentric and eccentric phase, nice and slow and controlled. And we're going to be putting an emphasis on posterior translation of the knee or posterior weight shift. Okay. So if you think about a box squat, when you do a box squat, you're sitting the hips backwards. You have a posterior translation of the hips and knees. That's going to decrease some of the stress on the knee. An anterior translation would be more of a heel tap or a sissy squat. So if I am doing a sissy squat and I'm reaching my knees forward as I squat down, that's going to be an anterior translation of the knee, anterior weight shift, more stress in the knee. So for the beginner physical therapy exercise, we're focusing on a posterior weight shift. Okay, let's get to the exercises. So here's what I want you to do next, guys. If you enjoyed this video so far, I have an entire course. It's free. It's called the Fitness Pain Free Mini Course. And we go over 3 lessons going to help you take a lot of this information that we went over so far and put it into practice. The first lecture is called Why We Need a Better System. So first and foremost, the way we treat fitness individuals, all right, athletic people in the gym from a physical therapy perspective is pretty much broke, okay? So we need a better system to serve the folks that are in the gym that get hurt, they want to get back to training, all right? Lecture number 2 is called 7 Reasons Why People Get Hurt in the Gym. And essentially, we have to know the reasons why people get hurt in the gym so we can keep them safe in the future, right? And when they get hurt, we have to know why and how to get them back to training in the gym. Okay. So a thorough understanding of this is very, very important. I actually have a really cool infographic that goes along with this lecture that you get for free as well. And lastly, we go over a case study of how to get someone out of pain and back to training. So these principles are all phenomenal, but we don't actually put it together and you don't understand how to create a program to get people back in the gym and keep them safe for the long term, then we lose, right? So I'll put a link in the show notes for this. It's a fitness pain-free mini course. Definitely check this out.